what's really important before we start any procedure is that we introduce ourselves to our patient if we haven't done that previously, but also to get informed consent from the patient before we do any procedure. So it's not just, can I do this? It's informing the patient of what you're doing and why you're doing it. And that enables the patient to actually ask questions and to ascertain that we're actually getting full consent, informed consent. Hi Manny, my name's Krishna. I'll be looking after you today.
Okay.
How are you feeling at the moment?
Not too bad.
Okay, I believe you have a wound on your heel, on your ankle.
Yes, I do.
I'd like to have a look at that if you don't mind, and then redress it for you to make it nice and clean.
Oh, okay, is that going to hurt?
It may sting a little bit with the solution that I clean it with, but it probably won't. So what it will mean is that I'll take the dressing down, I'll have a look at it, and I'll do an assessment to see what I need to put a new dressing on to just promote and improve healing.
Okay.
Do you have any questions around that?
No, that sounds good.
Thank you. So now I'm going to pull back your covers and have a look at your foot. Is that okay?
Okay.
Thanks, Manny. So once we've obtained informed consent from the patient, it's really important before we go and grab our gear, our dressing pack and our cleaning solution, is that we have a look at the wound and we do that assessment. So it's really important to have some gloves. I'm choosing to use gloves because I'll be pulling off a dressing and there may be some hemoserous fluid or some blood, which I don't want to get on myself. They are not sterile, they are just clean gloves. I'm just going to take some of this tape off on your foot.
Okay.
So I'm looking at the old dressing and I'm having a look for any hemoserous fluid or any dryness, having a look at any spread, any colour, and even any scent, any smell from that wound. So as I now assess the wound itself, I have a look at the edge of the wound, I have a look at if there's any redness, I have a look at any discharge that's coming, or if there's any granulating tissue forming around that wound, which indicates there's healing taking place. So now when I've assessed the wound, I need to start thinking about what do I need to clean this wound with, what equipment do I need, and if I need to change the style of dressing that they've been putting on. Is there anything else that I've missed?
That sounds good.
Yep. So with this, I'll need a dressing pack. I'd like to clean the wound with some normal saline. I'd like to dab it dry. And I'd like to put a protective dressing over the top of that. I may actually even consider putting a bandage over that to promote some blood flow. So once the wound is dressed and it's all nice and clean, you do have the option of using a bandage. Now there's several ways you can use a bandage, and one way you can use a bandage is as a protection against bumps or knocks, especially when it's on the side of the foot like as it is here with Manny. The other way is also having a compression sort of style bandage which promotes blood flow back up, so you're actually trying to promote healing through using a compression bandage. Now bandaging is an interesting thing, and it's actually not as common today or as popular today, and a lot of physios tend to take on the role. But I think it's really important that we consider using a bandage and how we use a bandage and ensure that we don't put it on too tight, we don't put it on too loose. If it's on too loose, it then can become a trip hazard or a slip risk. So you need to be really mindful of that. The other thing when you get the bandage, it usually comes with a clasp that has some metal spikes attached to it. That is considered a sharp and needs to be disposed of in a sharps bin. We actually do not use that. We would actually secure the bandage with some tape. Do you agree?
Yeah, they're a pet hate of mine because they tend to fall off a little bit in the bed and they can dig into particularly older people's frail skin. They can be really dangerous, so I hate those.
Yeah.
We use micropore instead.
Yep, so just discard. So the most important thing about bandaging is that you actually have it feeding nicely. So you're not going to drop it, you're not going to twist it, it's not going to get sort of unmanageable. And the other thing is that you need to anchor it to the limb, and it needs to be quite firm. So I'm going to go around twice, so it's a nice firm anchoring. Then I'm going around the back of the heel. And I'm going to use a figure 8 around the ankle.